Good evening and thanks for joining us. We know so many of you are working day and night to help in this pandemic, and there are lots of developments tonight. We have news about more protective equipment and test kits on the way. But for some perspective, let's start first with the worldwide picture. The number of confirmed cases of COVID-19 is now fast approaching 1 million. About 20% of cases are in the United States, which still leads the world in confirmed cases, 180,000 and counting. More Americans have now died of this virus than died in the 9/11 attacks. And even President Trump now says April could be a deadly month. And as the cases soar, so does demand for personal protective equipment, or PPE. We know some hospitals in Canada are already rationing things like masks, that its burn rate, how quickly it's being used, is far higher now than usual because of the risk. Today, the federal government promised $2 billion is being spent to buy more.
Public Services and Procurement Canada is aggressively buying in bulk from all available suppliers and distributors. To date, we have ordered millions of swabs, gloves, masks, and other vital equipment.
We will need more masks, ventilators, and testing kits. But how many more we need depends entirely on you.
The situation is going to get worse before it gets better.
There are long-term plans being made, worst-case scenario plans, knowing that medical equipment and ventilators are needed now and possibly for a long time. Some will be imported, some will be made here in Canada as companies retool and ramp up. Abigail Beeman has our top story tonight.
Quebec is burning through equipment 10 times faster than usual, a dire situation for the province with the most COVID-19 cases.
For some equipment, we have only for 3 to 7 days.
We have been able to cover all our needs up until this point and expect to be able to cover our needs for medical equipment in the foreseeable future.
The Prime Minister pledged $2 billion and says equipment will arrive in the coming weeks. Details on overall need and rollout are slim. The federal government has secured 157 million masks and 60 million N95 masks. Delivery for those and ventilators begins this week. Ottawa ordered 1,570 ventilators from Canada and abroad and is working to find at least 4,000 more. They've ordered more test kits too, but aren't saying how many.
Even though Canada is actually testing quite a lot of people, we want to do more. That is an absolutely critical area.
This emergency physician started a petition calling for a warlike effort and says today's announcement comes late.
We need to have access at least to the full suit. Like, it's ridiculous that we're just asking for one little mask when it's still on your hair and that sort of thing, and that we're begging for it.
Ottawa has been in touch with more than 3,000 companies that want to help, and today announced contracts with 3 of them for some of the masks, ventilators, and test kits.
We've signed an agreement to provide 500 ventilator systems to the federal government, and we also have an additional 40 more that will go to the province of Ontario.
We're also getting almost daily inquiries from other countries around the world and large corporations around the world. So we're proud Canadians, so we're definitely prioritizing Canada.
And that is why the Prime Minister stresses domestic production is so important, while Canada is also looking to find equipment all over the world. The problem is, so is everyone else. Abigail Beeman, Global News, Ottawa.
Here's a look at cases in Canada right now, and this is confirmed cases. We know not everyone with symptoms is being tested, and there's a backlog on tests in places like Ontario. More than 8,600 people are now confirmed to have COVID-19 in Canada. Quebec has the most people with the virus, more than 4,100 known cases. Ontario is second, nearly 2,000 cases. And in BC, more than 1,000 people have now tested positive. More than 100 people have now died of the virus in Canada. Those are not just statistics, those are individual people who are now being mourned by loved ones. And many lived in long-term care homes. At least 3 more people have died in one Ontario nursing home. The Pinecrest nursing home in Bobcaygeon has been badly hit. 12 residents there have died. So is a volunteer who worked at the home. Many of the remaining residents are sick, and at least 24 workers have tested positive. Each time we leave our homes, we increase the risk of spreading this virus and risk making someone so sick they die. Canada's Chief Public Health Officer outlined who she is most concerned about right now.
Our greatest concern at the moment relate to the introduction and spread of the virus in enclosed settings where vulnerable people reside. We currently have a number of ongoing outbreaks in long-term care homes, cases in First Nations and Inuit communities, and a corrections facility.
2 First Nations communities in Manitoba are asking the military for help to prepare for an outbreak there. In a letter to the Defence Minister, they're requesting a military hospital be built in their territories for testing and quarantining when the first cases are confirmed. And here's one indicator of how long we could be in this. Toronto Mayor John Tory today cancelled all public events in that city until the end of June. That includes all cultural events, concerts and festivals, including Pride Weekend.
This is not an easy decision to make. While we treasure many of these events and the important contribution they make to life in our city, protecting the health and safety of Toronto residents has to be our primary concern right now.
We know you have lots of questions about this virus. Our Jeff Semple will continue to consult with experts and try to answer them. Email your questions at globalnews.ca, and our website also has a special page dedicated entirely to COVID-19. You can visit globalnews.ca/coronavirus.